Hi, my name is Solomon Jennis, and today I'm going to be talking about plantar fasciitis, also known as policeman's heel. I'm going to be talking about ways to identify plantar fasciitis and how to treat and relieve pain. So I'm going to start off by going over what plantar fasciitis is. Plantar fasciitis is the inflammation of the fascia at the arch of the foot. The arch is what supports the entire body and disperses the weight of the entire body. When the arches aren't well structured, or for some reason the muscles are supporting the arch aren't strong enough, the arch doesn't disperse that weight, and all that weight comes down on the calcaneus bone, and that weight lands on the fascia, irritates it, swells, just general discomfort and pain. The causes and risks. So being of older age, from 40 to 50 years old, are more common to complain about plantar fasciitis. That's just how the body works. Usually, there's less support in the arch. Certain sports are also prone to have a lot of hard landings. So tennis, running, and volleyball. Standing for a long period of time, so professions like policemen or nurses, hairdressers, things like that, who are on their feet for a long period of time, that weight on the arch ends up causing that pain. The being overweight is also a risk factor for plantar fasciitis. Just again, so much weight at a certain point, the arch can't support. And having pre-existing foot problems can also be an issue that combined can cause plantar fasciitis. In general, being in a situation where the fascia of the foot is going to receive repetitive trauma will lead to some irritation. The symptoms for plantar fasciitis can appear gradually or all of a sudden. It's pain near the sole and tenderness near the heel. The pain can seem to increase at certain points of the day, maybe over the time span of a month, or as the weeks go by, you feel like it's not getting better, it's just getting more painful. In the morning, you can notice that the pain is more intense than it would be in the afternoon. In order to look at plantar fasciitis, I will be using the SOAP method. So subjectively, what the patient is observing and believes the situation is based on their position. I will also be using objectively what is measured and what can be proven through testing such as MRI, X-ray, usually from the medical professional side of things. The assessment, what will be addressed? So using my subjective and objective notes, what is the problem that's being presented? And how will that problem be worked on? What the goals are for that patient, and what realistically I can work with them to accomplish those goals. Setting out a plan. Therein follows the treatment, which is what recommendations will I make? What plan do I have to accomplish those goals that were set? Under subjective, I have the patient being an 18-year-old female who is complaining of heel pain in both of her feet. She feels that in the last couple of months the pain has increased, which is making sense in that she's playing volleyball for her college. She has had an irritation on several occasions, but when volleyball season picks up, it feels like it worsens. She reports that at the beginning of the day, she rates her pain out of 10, and at about 4 out of 10 at best, or by the end of the day. Under objective, after looking at her foot and doing a gait analysis, we have that there is swelling at the heel of the foot and tenderness at the medial plantar calcaneal region. She has a tendency to pronate, and her gait seems like it's been adapted to avoid any kind of pain or discomfort. The discomfort at the proximal plantar fascia with passive range of motion and dorsiflexion of the first toe. An ultrasound found that there are no other issues to be concerned about. You would have an ultrasound or an MRI just to make sure that there is nothing else causing that pain that she's feeling. Based on her subjective and objective notes, I will be saying that the patient has plantar fasciitis. The goals with the treatment would be to relieve her pain that she's experiencing now because of her plantar fasciitis, and then lower the likelihood of irritation and future incidents of higher ratings of pain. Under her treatment plan, I've decided to give her rest and ice as well. So under treatment, I have rest and ice, and for her physical therapy, going through some basic range of motion so that the fascia will not hinder her range of motion in the long run, stretching and strengthening. So I know as a volleyball player, especially for college, she's not going to want to hear rest, but lowering at least the instances that she has to be in high intensity so that the swelling can go down and the interventions that we do will have some effect. Maybe modifying the type of practices that she does so that she isn't landing so hard, modifying her game, her skills. Also, the shoes might be worn out and not supporting her arch. So maybe a change of shoes, just looking at her gear, looking at her skills, taking into account that she's a volleyball player. Ice will relieve pain temporarily. So when instances that she does feel like after practice that she needs some kind of relief, ice will help. I can recommend that she get some kind of accommodations if the pain intensifies, although she would have to probably consult with someone else about getting orthoses or some kind of night stent so that in the morning the pain isn't as bad. But it's still something to consider if the pain is not going away and it gets worse. In physical therapy, you can find some kind of relief to the pain that she's experiencing right now by doing the frozen can roll or the plantar fascia massage. So you would have the patient sitting at a chair, and with a frozen can or a cool can, it doesn't have to be frozen, it can be in the fridge. You start from the heel and you roll it back. It would be, and then roll it back to its original spot. It would be 1, 2, 3, up for a count of 10 reps for a set of 3. And you also have the plantar fascia massage, which has the person sitting, doing dorsiflexion, so to expose the fascia that's right here at the arch, and massaging it just through with your thumb. Again, it's just some kind of relief that you can get with the pain that she's experiencing right now. So maybe once in the morning and then once after her practice and at night, but at least once a day so that she can relieve some of that tension she's feeling in her heel. Again, in the physical therapy section, I have come up with a set of stretches for the patient to go through so that the muscles will be flexible and be able to support the arch in its day-to-day activity. So the calf stretch is the one that you see right here. You would have the person next to the wall and bent knee forward, straight leg here, and then you would press up against the wall, hold for 20 seconds, switch legs. This one's back here now, the foot's flat on the floor. Switch, kneeling back into the wall, 20 seconds, and that's a set. So you want to do 3 sets of 20-second holds for each leg. And then the soleus stretch is the same one that you see here but the only thing is this knee is bent. Both of the knees are bent when you lean into the wall. Heel still touching the floor, 20-second hold, switch, 20-second hold. That's a set. Do 2 more sets for a complete 3-set recommendation. You also have the fascia stretch, which is like the fascia massage, which when you sit down and you do a dorsiflexion here and you're pulling it so that this gets a good stretch right here. Again, 20-second hold each foot, 20-second hold the other foot for a count of 3 sets. You also have the towel stretch. You can do this on the floor. You grab a towel, wrap it around your foot, and pull towards you and hold for 20 seconds, switch foot, hold for 20 seconds. That's 1 set. Do another set of 2 for a recommendation, of 3 sets. You would want to do this at least 3 times a day, again probably in the morning, and then if there's irritation in the midday, but probably after one of the practices and at night. We have the physical therapy strengthening protocol that I've come up with. Right now, I would imagine that there's more pain, so you would want to start off with something light, and as time progresses, you can add to the intensity of these exercises. So we have the towel pickup, which you sit down at a chair, and with the curling of your toes, you're going to pick up the towel and pick up the towel and then drop, pick up the towel and then drop. So it'd be 1, pick up, drop, 2, pick up, drop, and you want to do a rep of 10 for 3 sets on each foot. Heel raises, you can do this near a wall, and you're coming off your heel onto your toes, trying to stay pretty straight so that it's your calves and your supporting muscles of your arch that are doing the lifting. So that way you strengthen that arch, and there's less occasions of fascia irritation. I would recommend that if this starts to become pretty easy, to start doing 1 foot at a time. Again, I know that the pain is a little more overwhelming than you would like it to be, so as the pain releases, you can intensify this exercise. I would recommend doing this 5 times a day, since it is a short protocol for now. With the aid of these interventions, it may be possible for my patient to return to normal activity and continue playing volleyball without discomfort in the future. Again, thank you so much for watching this video. I have my resources here listed at the end. Thank you again.